Hi, everyone. You have Jane Sagway, one of Pollie's co-founders here, and I am thrilled to be joined by Rachel Gelman, who is the owner of Pelvic Wellness and Physical Therapy based in San Francisco. She is a pelvic floor physical therapist, and she's going to be teaching us all about pelvic floor health today and how it correlates with hormonal health. And I'm personally really excited for this discussion, which is telling Rachel that the extent of my pelvic floor health knowledge is just how to do a Kegel, and I don't even know if that's the proper way to do it. So with that, Rachel, would love for you to introduce yourself.
Yeah, well, hello. I'm, like you said, Rachel Gelman, and I am a pelvic floor physical therapist in San Francisco. I've been in practice for over 8 years now, and I've always pretty much specialized in pelvic health and pelvic floor rehabilitation. I'm particularly passionate about pelvic pain and sexual wellness, but I treat anyone with a pelvis and all forms of pelvic floor dysfunction. And so I am excited to chat with you all about it.
Awesome. So just to kind of set the stage, would love an overview of like your definition of what pelvic floor health even is. And I've known more about it in context of pregnancy and postpartum. I'm not personally at that stage of my life yet, but would love to kind of hear from that perspective, as well as someone who's not pregnant or postpartum, but is just somebody in their 20s, 30s with a uterus.
Yeah, so I always like to tell people everyone has a pelvic floor. The pelvic floor is a muscular bowl inside of the pelvis, and it supports the pelvic organs. So that's the bladder, the uterus, or the prostate. So people with penises and vulvas, everyone has a pelvic floor. And then the pelvic floor muscles also support the colon. So these muscles are involved in supporting those organs. And since those different, there's the urethra that goes from the bladder, the vaginal canal, and the anus, those muscles wrap around all those openings. So they're involved with starting and stopping the flow of urine, maintaining continence. So when you want to have a bowel movement, you can defecate. And they're involved with sexual function. So they help obtain and maintain erections. They're involved with orgasm. So I would say like good pelvic floor health would be having control over all those systems and being able to perform all of those functions without any pain or difficulty. So if people tell me they're having a hard time urinating or they're leaking when they sneeze or cough, that would be a sign of pelvic floor dysfunction. If they have pain with urination, pain with sex, pain with bowel movements, or difficulty with bowel movements, those would all be signs that they might have pelvic floor dysfunction. These muscles also provide like just overall core stability. So they help us stay upright and maintain our posture. So sometimes if people tell me they have low back pain or even abdominal pain or hip pain, those could all also be a sign of pelvic floor dysfunction just because of those muscles provide overall stability. So it's not, everyone kind of thinks, oh, pelvic floor pregnancy, pelvic floor incontinence, and it's a lot bigger than that because it serves so many functions and supports so many systems. So overall pelvic health, again, pelvic floor health, I would say is being able to do all those functions I listed, and also being able to have good posture and be able to exercise and do everything they want to do without pain or dysfunction.
Awesome. Yeah, definitely a very integral part of just being a human. So it's important to know. So kind of getting into Kegels, and like I mentioned, this is kind of my perception of like how to improve my pelvic health as someone that has not yet had children. I think that a lot of people that are like kind of a millennial pre-kids, this is how we think of pelvic health, and I think that all of our understanding of it is pretty flawed because mine is that from magazines. So I would love to hear your take on Kegels, if they're worth the hype.
Yeah, they are not worth the hype, and you're definitely not alone. Everyone, I feel like if we played a game of word association, when people hear pelvic floor or pelvic health, they think Kegels. And yeah. I don't know who did the PR for Kegels, but they are doing a great job because they really aren't that cool, and there's so many other things that help the pelvic floor that aren't Kegels. So for those that don't know, a Kegel is literally just contracting them, relaxing those pelvic floor muscles. And so it really that's all it is. And it can sometimes be useful for some people after having an actual examination of the pelvic floor muscles to see what they feel like, because most people that at least I see clinically, and I think a lot of my colleagues see clinically, most people don't have a weak pelvic floor. They actually have a guarded or tense pelvic floor. And so if those muscles are already in a tight, guarded, tense, spasmodic state, having someone try to contract those muscles is not going to help. If anything, it might make things worse. So most people, I'm trying to teach them how to relax those muscles and teach them how to relax them correctly. And then we might go over how to like engage them and then relax. But the muscles, the pelvic floor muscles, need to be able to contract, relax, and lengthen to function. And for some reason, everyone's very focused on this contract, engaging piece. And we don't ever really focus on or talk about the relaxation and lengthening part. Just like, you know, with your bicep, it wouldn't make sense to tell someone to just constantly contract because that's not very functional. And after a while, my arm is going to hurt or it's going to get in a bad position. And people often think like, oh, well, but like for incontinence, obviously I'm going to need to do Kegels. And that's not correct either, because again, if these muscles are stuck at an end position and then they need to hold back urine, they don't have anywhere to go. And so they can't contract any farther. And so it's common that I see people who have incontinence are trying to do Kegels, but it's not helping because their muscles are already so clenched that Kegels aren't going to help them. We need to get them to, again, move and relax and move through that range of motion. Also, the research shows that most people do Kegels incorrectly. When I have people come in, I ask them to Kegel. A lot of times they just squeeze their butt or hold their breath or squeeze their legs together. A true Kegel would just be these muscles contracting them, relaxing. So the research shows a lot of people can't do them correctly with verbal like instruction alone. So that's what drives me crazy in magazines when they're like, you can do Kegels anywhere, just contract and like drive around town, and every time you're at a stop sign, do your Kegels. And I'm like, no, like most people can't. Yeah, it's like they are like, it's so easy. And I'm like, they really aren't. Kegels are not easy at all. And also, if not everyone needs to just be contracting them, relaxing. Some people need to work on the endurance part. Some people need to work on just like quick coordination. So there's so many different levels or layers to Kegels, and it's not one size fits all. And again, the thing I always tell people is they're really not the end all be all cure all for the pelvic floor. There's a lot of other things that can be beneficial, and Kegels sometimes and often aren't even on that list.
Yeah, no, that's super interesting. And in terms of getting to the point of relaxing, and obviously I want to make a disclaimer that you likely see a pelvic floor therapist before doing any of this yourself, but are there like exercises you can do yourself to relax, or like self massage work and that kind of stuff?
Yeah, there's definitely.
Go ahead, sorry.
No. I was gonna say, I'm like, yeah, there's definitely a lot of things that can help. And you know, some of it's just basic, some are just like simple yoga poses can sometimes be helpful, like child's pose, happy baby, are all great positions that automatically relax the pelvic floor. The thing that I think I always tell people about pelvic health and getting the pelvic floor moving is, since those muscles are constantly supporting those organs and providing just stability, any like form of exercise is going to recruit those muscles. So doing any form of just like low impact cardio is probably going to get those muscles moving, get blood flow in the area, and that can actually in a way help those muscles relax a little bit and get them moving. And that's kind of what we care about. Versus just a static contract, relax. But definitely, like I said, doing things like child's pose, I think, is a great way to just facilitate relaxation. But obviously, yeah, it's hard to give a recommendation for the masses because it's so individualized. But there's definitely a lot of things that people can do and learn in order to relax their pelvic floor.
Very cool. No, super
Yeah.
interesting. And even just when you were talking, was kind of taking note of where I was holding tension in my body and definitely holding tension in the pelvis area.
Yeah.
So it just makes total sense based on everything else that we know about health and how bad it is to hold tension in places. But anyway, moving on. So getting into painful sex. So I do know of my minimal knowledge that like painful sex is correlated with some pelvic floor dysfunction, but would love for you to kind of explain that relationship and then also even get into like how hormones may be playing a role.
Yeah, so again, if those muscles are in a guarded, tense, spasmodic, unhappy is what I like to say, unhappy state, then when something tries to enter the vagina, or if someone's having anal sex, it would be the same thing. But if something tries to penetrate or enter that area where these muscles are in a tense, guarded state, it's not going to feel very good. When muscles are tense and tight, that's also going to impact how much blood flow can get into the area. And blood flow is really necessary for arousal, and arousal helps produce lubrication. And so if there's a lack of lubrication, that's going to make things not feel great with sexual activity.
Yeah.
But a lot of times what can happen, and people don't really talk about this enough, is the vaginal opening, the vaginal canal, all the tissue around the urethra, as well as the clitoris, depends on hormones, primarily estrogen and testosterone. And so if there's something going on that's impacting those hormones, it can impact that area of the body and lead to things like pain with sex, decreased vaginal lubrication, and that can lead to things like pain with sex, pain with orgasm, clitoral pain, vaginal pain, vulvar pain, what have you. And a lot of things, most people think like, oh, menopause. And it's like, yeah, that's definitely one thing that can cause these hormones to get out of whack. But there's a ton of other things that can lead to a hormonal imbalance. After having a baby, the hormone levels automatically go down. Estrogen, progesterone decreases, and that can cause people to experience pain with sex. There are certain medications that can alter these hormone levels. There's certain medical conditions. So there's a lot of different things that can impact those hormones, but it's just important to be aware that all of that tissue needs adequate estrogen and testosterone to be happy and healthy. So I see a lot of people who maybe it started out as something like a hormonal dysfunction, and because that tissue isn't as happy and healthy, the muscles are kind of like, whoa, what's happening? We need to protect this person. So they go into this guarded, tense state, and that increases the pain even more. And so then we create this feedback loop of the muscles are guarded, and now they try to have sex, it hurts, so they guard more, and that makes it hurt more, and it becomes this bigger issue. So sometimes people need to work with not only me on the muscle piece, but also with a specialist to address the hormonal aspect of what might be causing their pain.
Super interesting. No, that's really, really interesting. And I know we've done a lot of work with Pollie about postpartum stuff, because your body really can enter to like menopause like state during postpartum, and so and also have a lot of stuff going on in terms of your pelvic floor with postpartum. So that's really interesting. I did not know that.
Yeah.
And then lastly, getting into our bowels intact. So I have heard that obviously going to the bathroom, just bowel movements in general, if you're having pain or trouble, that can be a symptom of a pelvic floor issue. But just would love to hear about how that kind of plays a role, because obviously this isn't just our reproductive system. We're now talking about like our urinary tract we've mentioned a few times, and also our DMs. Sorry.
Yeah. It's funny because whenever I talk to people about like sexual health or pain with sex, I always end up talking about pooping, and it's like not a very sexy thing, but it really does play an impact in sexual health and just overall pelvic health. And definitely constipation, pain with bowel movements can all be signs of pelvic floor dysfunction, but constipation can definitely lead to or cause pelvic floor dysfunction and pelvic pain. So I always tell all my patients or anyone I meet, honestly, about how to have better bowel movements, because if you push and strain to have a bowel movement, that's going to put a lot of pressure on those little tiny muscles. And when you get a lot of pressure on those muscles, they're going to react again by contracting and guarding. So if someone's really pushing or straining to have a bowel movement, that's not good for the pelvic floor. If there's a lot of stool just hanging out in the colon, putting pressure on the pelvic floor and the surrounding organs, that's also not very good for the pelvic floor. So the thing I always talk to people about is either getting, I don't know if you know what the squatty potty is, but there's something on the market.
I've always been tempted, so maybe this will convince me.
Yeah, so something like the squatty potty. You can even just get like a small step stool or some books or something to put under your feet so your knees are above your hips, because as human beings, we are not meant to sit on a toilet to have a bowel movement. We are meant to squat. That's how, when we were cave people living out in the world, that's what we would do. So if we can get in a squat-like position, that is the optimal position for defecation. And it really helps relax one muscle in particular. It's called the puborectalis, and it wraps around the rectum kind of like a slingshot. And when we squat to have a bowel movement, it automatically like relaxes a little bit, so that it's easier for stool to come out. So that is usually like kind of my first thing I recommend to everyone, because it's just going to help you poop better, and having a better bowel movement makes for a better day, in my opinion. And so starting to do that it can definitely not only help like your bowel habits, but just your pelvic health in general. And then, you could get into talking about like, obviously make sure you're drinking enough water, having a good, healthy, high fiber diet. All of those things are going to help with overall health as well as just bowel movements. But the squatty potty piece or the bowel position is definitely going to make a big impact on someone's pelvic health.
Super neat. Yeah, no, pooping is so important for everything.
It really is.
Pooping out your hormones so that you don't have a buildup of estrogen and stuff in your body, and any hormone basically. One question, so is this just like kind of chronic constipation? Like, should people be worried if they've had like a few days of being a little bit constipated, or is it more so just a lifestyle?
Yeah, I mean, yeah, I'd say like a few days, or sometimes, people are like, oh, like it happens once a year or like every so often. That's not, I don't think people need to be overly concerned. If it's becoming a chronic issue and they're not having a bowel movement for 4 or 5 days, or every time they try to have a bowel movement, they're really pushing, straining to get it out. That's definitely something you should see a provider about or really start to address. But if it's just kind of, sometimes people are like, oh, if I accidentally ate like In-N-Out and a ton of like fast food and stuff like that, like my diet wasn't very great, and then I was constipated once, I'm like, okay, that's probably not like a big deal. But if it's like a very regular occurrence, that's probably not a good thing.
Very cool. Awesome. So now we're going to get into our Q&A. We'll pull up some questions from our listeners. And thank you for going through that stuff. That was really, really informative. And
oh, good.
I definitely learned a lot. It was fun. So our first question that we have here is similar to, we covered this, but maybe just can cover this person specific question. Is sporadic sharp pain while going to the bathroom, both urinating and bowel movements, a sign of a pelvic floor issue?
It definitely could be related to the pelvic floor. I mean, there's a long list of things it could be, but definitely the pelvic floor could be a contributing factor. I always tell patients and people that with the pelvic floor or like symptoms in this area, it may not just be one thing causing the problem. There's usually kind of all these puzzle pieces that we need to look at to create a picture of what's happening. And so the pelvic floor could definitely be causing those symptoms or be contributing. There could be a dietary piece, there could be a hormonal piece, there could be an actual issue with the actual bladder or the colon. But they're definitely based on just that brief description, I would be comfortable saying it sounds like there's probably some pelvic floor muscle dysfunction or some sort of myofascial dysfunction going on. But yeah, there could definitely be a bunch of other things that are going on and contributing to the symptoms.
Well, and I have one little follow-up question myself actually on that, that builds on that. So in terms of like the pain associated with pelvic floor dysfunction, is it going to be sharp pain or dull pain? Does it tend to be sharp pain or dull pain? Does it not really matter, but just what should people look out for in general?
Yeah, it can be anything: sharp, dull, aching, stabbing, shooting, burning, cramping. Basically anything that is a not so good sensation, I would say could be pelvic floor. But yeah, there's all sorts of different descriptions of pain that I have heard.
Well, not cool, but helpful information to know. And then second question is, can endometriosis make pelvic floor disorders worse?
Yeah, they definitely tend to go together. So endometriosis is when endometrial tissue, which normally is naturally inside of the uterus, is growing outside of the uterus. And it can cause a lot of symptoms. Usually the big one people know about and talk about is very painful periods, but they can have bowel dysfunction, they can have urinary dysfunction, they can have pain all the time. It's a really horrible illness. And because of that inflammatory process that goes on with endometriosis, again, just because of the uterus and those different organs living in the pelvic floor, those muscles are naturally going to be guarding and tensing up in response to this inflammatory process happening in that area. So I definitely see a lot of patients with endometriosis who have pelvic floor dysfunction. So they definitely, go together. And so there's definitely ways to help them to have less pain. But yeah, they definitely are kind of a coexisting pair.
Intertwined. Yeah, absolutely. Endo is tough. Next question we have here, is it possible to have prolapse, or is it possible to prolapse without having children? The person provided some context that they're a weightlifter.
Okay. Yeah, it's definitely possible. Something I didn't mention earlier with having better bowel movements is that a lot of times patients I see that end up having a prolapse that haven't had children, it's because they had issues with like chronic constipation. So the pushing and straining with bowel movements puts a lot of pressure on the vaginal canal, and that can lead to things like pelvic organ prolapse. If someone's lifting a lot and they're kind of bearing down or performing what we call a Valsalva, which is you're going to increase the abdominal pressure, and that pressure is going to push down on your pelvic floor. So push down on the pelvic floor. So again, that can lead to a prolapse. So yeah, it's not just a childbirth issue. It can definitely happen. I've seen many people who have a prolapse that have not had babies.
Okay. And just, I don't know if I said this at the beginning, but prolapse is when your organs start to come down, correct?
Yeah, so the vaginal canal is like an elastic tube, and in front of it is the bladder, and behind it is the colon. And at the top is the uterus. So what can happen is it's the vaginal, like the top of the vaginal wall can start to collapse. And as a result, the bladder falls into it. And so it kind of starts to protrude out into the vaginal opening. Or the posterior wall of the vaginal canal starts to get a little lax or have some laxity, and then the colon starts to fall in. Or you can have the uterus start to fall in from the top. So it's it's laxity or decreased tension in the vaginal canal that causes one of those organs, or sometimes people will have multiple. Well, it's from the front and the back. And then it's falling into the vaginal canal.
Yeah, thank you for that. That's helpful. We haven't really talked about prolapse on Pollie before, so that would be helpful. And then last question we have is, how do you know if your pelvic floor is weak or just not doing well in general?
Yeah, so again, it's rare that I would say the pelvic floor has true weakness. So I always like to kind of clarify that. I would say ways to know if or signs that your pelvic floor might be dysfunctional would be if you're experiencing any symptoms that are surrounding like bladder, bowel, or sexual function, or just pain in general. So could be urinary urgency and frequency. People sometimes say it feels like they have a UTI, but they go to the doctor and they don't have a UTI. There's no infection, but it's like they're peeing all the time. They feel an urge to pee all the time. That can be a sign of pelvic floor dysfunction. Incontinence, either urinary incontinence or fecal incontinence, pain with sex, and pain with bowel movements, constipation, and just pain in general. So it could be vaginal pain, vulvar pain, tailbone pain, pain with sitting, abdominal pain, groin pain, hip pain, back pain, all of those things. Usually I say if it's between the rib cage and the knees, you know, it could be related to pelvic floor dysfunction. So those would be the things I would say could be signs that someone has pelvic floor dysfunction. Again, there's definitely other things that can cause those symptoms, but those are definitely possible signs that someone has an issue with their pelvic floor.
Yeah, or it's at least playing somewhat of a role.
Mm-hmm.
Super interesting. Well, thank you so much.
Yeah, of course.
This is such an important topic, and it's really, it's kind of similar to hormonal health in the sense that, like, none of us were taught about this in school growing up. It wasn't really a discussion with my doctors growing up ever. If someone did have that discussion, you're lucky, I would assume. But really, really love what you're doing, and so appreciate you taking the time. And where can people find you if they want to learn more about pelvic health?
Yeah, so my website is pelvicwellpt.com. On social media, Instagram is probably the best place. It's Pelvic Health SF, but if they search Rachel Gelman on Facebook or Twitter, they would find me as well, but I'm not as good with Twitter. So Instagram or my website would be the best places to connect if people have more questions or want more information about pelvic health.
Awesome. And we will link those in the YouTube as well as the Instagram post once we get this up and running.
Awesome.
But thank you so much, Rachel. Really, really enjoyed this. And
yeah.
excited for everyone to listen.
Yeah.